Have you ever made a mistake that cost you more than you ever imagined? When it comes to Medicare, some mistakes don't just sting, they haunt you forever. Late enrollment penalties are no joke. They don't go away. They just keep draining your wallet month after month, year after year. In 2021 alone, 779,000 people were hit with the Part B Late Enrollment Penalty. In 2022, over 2.5 million people were stuck with a Part D penalty. And there's a third penalty, a sneaky one, that most people and even professionals don't know about. But it's devastating. The good news is you still have time. Let me help you avoid the pain of Medicare mistakes. Meet Walter. He was a kind-hearted minister who always put others first. At 87, he finally decided to retire and wanted to enroll in Medicare. He had delayed Part B because his employer's health insurance covered him. But here's the kicker. Medicare needed proof of his prior coverage all the way back to age 65. One employer had gone out of business, so there were no records and there are no exceptions. Walter was hit with an 80% penalty on his Part B premium for life, for the rest of his life. Avoid this trap by enrolling in Part B during your initial enrollment period, which is 3 months before your 65th birthday, the month of your 65th birthday, and 3 months afterwards. Make sure your employer health coverage is credible, that is as good as Medicare. And sign up for Part B within 8 months of leaving your employer health coverage. And COBRA doesn't count. It won't extend your Medicare window. If you miss your window, you must wait till Medicare general enrollment, and yes, you'll probably end up with a penalty. A business owner I met with, smart, vibrant lady in her late 70s, told me, I don't take any medications, so she skipped enrolling in Part D. Then her doctor recently put her on Eliquis, and she was shocked at the price of Eliquis, very expensive. Then came the second surprise, a Part D late enrollment penalty. She had 14 years worth of late enrollment penalties to pay because she hadn't enrolled in a Part D prescription drug plan when she first was eligible. And that penalty is for the rest of her life. Avoid this trap by enrolling in Part D when you're first eligible. Even if you're healthy, even if you're on no medications, get a Part D plan. Make sure your existing drug coverage is as good as Medicare. Never go more than 63 days without having credible drug coverage. This penalty flies under the radar, and it's costly. More people are working past 65 now and have high deductible health plans and HSA accounts, health savings accounts. But did you know once you're enrolled in Medicare, even just Part A, you can't contribute to an HSA? I talk to someone probably every week who's unaware. Their employers quite often don't make it clear to them, and they end up with this costly penalty. What happens if you keep contributing after Part A enrollment? Well, you owe the IRS a 6% excise tax. Every year, the money stays in the account. Medicare Part A enrollment is retroactive by 6 months, so you must stop your HSA contributions at least 6 months before going on Medicare past 65. Avoid this trap by halting HSA contributions when you go on Medicare at 65. Delay Social Security if you want to delay Medicare. Withdraw excess HSA contributions before tax time to reduce your penalty. These penalties, they're not small. They're lifelong and, most importantly, avoidable. The key is having the right guidance. That's where I come in. If you're nearing 65 or even past 65 and unsure, let's chat. Give me a call at 402-614-3389. Chris Grimman. Speak with a licensed insurance agent professional so we can make sure you get it right the first time. Don't leave your future to chance. Let's protect what you've worked so hard for.